For the knee McConnell taping technique, the athletic training student will position the patient sitting on a table or bench with the knee in extension and the quadriceps relaxed. They will then shave the patient around the knee if it is necessary. Following the taping job, the ATS will ensure that the taping technique is neat and functional, and they will document after proper fit has been determined and verbally explain when they should discontinue use. The ATS will then apply 2 strips of 2-inch or larger adhesive gauze material directly to the skin over the patella, extending from the lateral femoral condyle to the posterior aspect of the medial femoral condyle to serve as a base. To correct the tilt component, the ATS will anchor a strip of rigid non-elastic tape on the middle of the patella. Pull the strip in a medial direction and push the soft tissue on the medial aspect of the knee toward the patella and anchor on the adhesive gauze material over the medial femoral condyle. To correct the glide component, the ATS will anchor a strip of rigid non-elastic tape on the lateral border of the patella, pull the strip in a medial direction, and push the soft tissue on the medial aspect of the knee toward the patella and anchor on the adhesive gauze material over the medial femoral condyle. To correct the rotation component, the ATS will place a strip of rigid non-elastic tape on the middle of the inferior pole of the patella at an angle, pull the strip upward and medially, and anchor on the medial aspect of the knee. The superior pole of the patella should rotate laterally. To correct the anterior-posterior component, the ATS will place a strip of rigid non-elastic tape across the upper half of the patella and anchor the strip on the lateral medial femoral condyles.